Good morning, social media and YouTube. I'm going to do today's video on heart disease. And so this is a big thing because 1 in 4 people dies of cardiovascular disease as they age. And this is something that really can be prevented. We need to take some nutrition tactics, but when I look at people, I look at their DNA and then give them recommendations on their nutrition that needs to change as far as exercise and nutrition too. But so these people are always going to be your higher anxiety people. They're going to be high stress, which means that they're going to have higher catecholamines that cause blood vessels to constrict. There's a lot of factors that go on with this. But when I look at somebody who is concerned about heart disease, I'm going to look at nitric oxide production. I'm going to look at peroxynitrate. I'm going to look at homocysteine. I'm going to look at angiotensin converting enzyme. And those are the big things I'm really going to look for. So when I'm looking for nitric oxide, if I see issues within the nitric oxide cycle, I will give them SOD or citrulline because excess amount of or not enough nitric oxide could possibly lead into higher amounts of peroxynitrate. So we can give them SOD, superoxide dismutase, to block that peroxynitrate production or counterbalance that. The other thing that we can do is give them choline. Choline is also very helpful for those people that have higher levels of peroxynitrate. So it's going to basically push that through the cycle, the methylation cycle, and decrease that inflammation. And homocysteine is a really big one, and that's the biggest one I look at. It's a bigger indicator than cholesterol, any of that stuff. And so, usually you want to give someone folate or B12, but somebody who has the anxiety with it, it might actually push them into that. So we got to take some steps back and improve their digestion and detoxification first before we give them the folate and the B12. So, everybody hears about MTHFR, and, the big thing is to give them folate. Well, yes, they do need more folate to help them with that cycle, but you can't do that right away. Or you could actually create more glutamate, and that will increase anxiety, and they just can't handle it. That'll actually cause more inflammation, cause nerve tissue problems. So the other thing is getting to the angiotensin conversion enzyme, and so I look at this CBS variant, and in that variant that is expressed, that could lead to excess amount of ammonia, which could convert to peroxynitrate as well. So we want to make sure we're looking at that cycle, and we can help them with that by giving them glutathione. So you got to know the whole piece of the puzzle if you really want to help somebody, and the person also has to be willing to work and change their lifestyle as well. So with all this stuff, it takes some time to make the balances and changes in their life, but once you get there and the inflammation comes down, and we can test all this through an organic acid test to make sure the levels are getting back to normal, we don't have excess oxidation. But in the meantime, if somebody has high blood pressure because they're creating too much homocysteine and it's rushing down, and then what we're going to do is just give them some Hawthorne temporarily to hopefully lower that. Unless it's extreme, then you want to get them to the doctor and get them on an ACE inhibitor or something like that to lower their blood pressure. Her medical doctor. So other things to note is, I'd always look at vitamin D and assess whether or not it had sleep apnea, because if you have if you have sleep apnea, you're not taking enough oxygen, you're going to have excessive amounts of oxidation. There's all kinds of things that occur with that exchange of carbon dioxide to oxygen. So hopefully you guys can understand what I'm talking about and realize there's a solution for you. Reach out to me if you have questions and you're concerned about this. Go to www.protouchrehab.com. It's a simple test. It's just a genetic test kit and an organic acid test. It's a urine test, and we can figure this out for you. All right. Hope you guys have a good day.